Give me a minute to set up for the show, and I'll be right with you. Okay. Today's topic A is talking about Alzheimer's as a sleeping financial crisis. Okay, so we're going to dig into that today for A. So please join me for today's discussion. All right, here we go. Alzheimer's already carries enormous and rising economic costs. Treating it as a sleeping financial crisis is accurate. The U.S. faces hundreds of billions in direct care costs today and potentially nearly $1 trillion by mid-century, unless detection, care, and policy change are invoked. Quick summary and why the phrase fits. Alzheimer's imposes large concentrated fiscal pressure on families and public programs. 7 million Americans age 65 live with Alzheimer's, dementia, and U.S. care costs were about 360 to 384 billion in 2024-2025, with unpaid family caregiving. Valued in the hundreds of billions. These costs are projected to rise sharply as the population ages, potentially reaching nearly $1 trillion by 2050. Alzheimer's Association portal key facts to anchor the claim. Prevalence 6.9 to 7.2 million Americans age 65 with Alzheimer's in 2024-2025. Okay, direct care costs 360 billion in 2024, 384 billion in 2025. Estimates appear in Alzheimer's Association and materials. Unpaid caregiving. Family and friends provided 346 to 413 billion in unpaid care valued hours across recent years. Broader economic accounting. A USC-led model estimates total societal burden, medical care, lost earnings, and quality of life losses at 781 billion in 2025. Why this becomes a fiscal crisis. concentration in entitlement programs, Medicare, Medicaid. Medicare and Medicaid already pay a large share of Alzheimer's costs. Projections show these program expenditures rising steeply, increasing pressure on federal and state budgets. Hidden costs, lost earnings, caregiver labor market impacts, and reduced quality of life are large and often omitted from headline figures. Together they multiply the fiscal and social toll. Policy levers that could change the trajectory. Early detection and screening coverage, blood tests, and AI tools to enable interventions and lifestyle changes that delay progression. Support for caregivers, paid leave, respite, financial supports to reduce unpaid caregiver strain and preserve workforce participation. Investment in prevention and care navigation to shift spending from late stage crisis care to earlier, less costly management. Practical takeaway for policymakers, prioritize coverage for validated early detection tools and caregiver supports. Model long term budget impacts under different intervention scenarios for families and employers. Recognize caregiving as an economic risk. Plan for workplace flexibility and financial counseling. Alzheimer's Association facts and figures. 2024-2025 Alzheimer's Disease International World Alzheimer's Report. 2023 USC US Cost of Dementia Project. Commentary by Charles Sawyer. Confirmed numbers and the USC-led U.S. cost of dementia model estimates the total economic burden at about $781 billion in 2025, driven by $232 billion in medical and long-term care and very large, often hidden losses from unpaid caregiving and reduced quality of life. Key numbers and what they mean. Give me 1 second, folks. I'll be right with you. These are kind of stuck. Give me a minute here. One second. Total economic burden, $781 billion in 2025. This is the USC team's comprehensive societal estimate that combines medical spending, unpaid care, lost earnings, and monetizes declines in quality of life. Medical and long-term care spending, 232 billion, of which 52 billion is out of pocket by patients and families. Public programs share: Medicare 106 billion, Medicaid 58 billion. Together they cover more than 2/3 of formal care spending for people with dementia. Folks, why I'm doing the show this afternoon is to open people's eyes, is to get people to realize that, this matters to folks. Okay. Unpaid caregiving and quality of life losses. Care partners provide 6.8 billion hours of unpaid care, valued at 233 billion. And the model places a 302 billion value on the decline in patients' quality of life. Prevalence used in the model: 5.6 million Americans living with dementia in 2025. About 5 billion age 65. This is why this matters for policy and budgets. The USC estimate reframes dementia as a broad fiscal and social problem, not just a healthcare line item. Large shares of unpaid of the bill fall on Medicare, Medicaid, and unpaid family caregivers. The monetized quality of life losses mean the societal burden is far larger than medical invoices alone. These features make dementia a candidate for long-term budget planning, caregiver support, and prevention estimates. Practical implications and near-term actions for policymakers. Model long-range budget impacts of dementia under alternative scenarios. Earlier detection, caregiver support expanded. Home and community services. The USC model is explicitly designed for or designed to inform such policy trade-offs. Health for health systems and payers prioritize interventions that delay institutionalization and reduce acute care use. Quantify how these shifts change the 232 billion medical spending line for employers and families. Recognize caregiving as an economic risk. Workplace flexibility, paid leave, and financial planning can reduce earnings losses and workforce exits. Notes on interpretation. Give me 1 second. Scope. Okay, scope of the problem. USC figure is broader than many prior estimates because it explicitly includes monetized quality of life losses and unpaid caregiver or care value, not just medical bills. That methodology or logical choices is why the 781 billion number is larger than some other published totals. Updates. This is the first annual national estimate from U.S. cost of dementia projects. The team intends to publish updated annual figures and interactive visualizations to track trends and geographic variation. Short answer, yes, recent USC-led modeling places the comprehensive U.S. dementia burden at about 780 to 781 billion for the most recent year, reported a figure that combines medical and long-term care spending, unpaid caregiving, lost earnings, and monetized declines in quality of life. The USC United States Cost of Dementia Project produces a comprehensive societal estimate rather than a narrow medical bill total. The first annual national estimate reports a 781 billion economic burden. The press materials describe this as this year in the team's release with 232 billion in medical and long-term care spending and a very large additional values for unpaid caregiving and quality of life losses. Medicare and Medicaid together pay a large share of formal care costs. Quick numbers to keep in mind. Total societal burden 781 billion. USC model headline. Medical and long-term care spending 232 billion. Unpaid caregiving value 6.8 billion hours, valued roughly 233 billion. Okay, monetized quality of life losses 302 billion for people with dementia, plus an additional losses of care partners. Other published estimates. Alzheimer's Association reports 360 billion in health and long-term care costs and projects just a second, guys. Got this all. Costs could approach 1 trillion by 2050. The USC model's broader scope explains why the headline is larger. The guide for interpreting and using this number. Key considerations. Scope matters. USC figure internationally includes non-medical costs, caregiver time, lost earnings, quality of life monetization, which inflates the headline relative to medical only tails. Yes. Date labeling. Different outlets may label the USC number as applying to 2024 or 2025. Check the original USC release date and the model's reporting year when citing the figure. Decision points. Okay, here you go, guys. I'm going to give you the budget impacts of Alzheimer's. Just a second. I'll do it. Budgetary impact on Medicare, Medicaid. Focus on the 232 billion medical spending line and the program shares. Societal or policy framing. Use the full 781 billion estimate to show hidden burdens on families and the workforce. Methodological choices. Drive headline size. Monetize quality of life and unpaid care is defensible but subjective. Different methods yield different totals. Policy implications depend on what you measure. Narrow medical totals point to payer reforms. Broader societal totals argue for caregiver supports, workplace policy, and prevention investments. Okay, guys, that's your A for today. I'll be back on with B shortly. Give me a bit for that, please. And I'll be back on with that for you in a bit. For now, Gator Wellness, take care, folks.